Hi, I'm Dr. Victoria May. I'm a plastic surgeon in Scottsdale, Arizona. Today I'm going to tell you about my top tips for abdominal binders. So this is an abdominal binder. Typically we apply this just like so at the end of a tummy tuck procedure. And this is something we often have our patients wear typically for at least a couple weeks after a tummy tuck. So some of the most common questions I get are, number one, when I come out of surgery, is it okay if I open this? Can I loosen it? Is it going to make my incision open up? So as plastic surgeons, we're going to close your incision in multiple layers with sutures. And this device is not keeping that incision closed. So by opening this, it's not going to make your incision split open. So number one, if you need to open it and loosen it, or you need to open it to change your dressings, that's okay. Not going to interfere with your incision, your fresh post-op incision. So number two, the most common question I get after that typically is, how tight or snug should I make this? This is not a more is better kind of situation. This is more of a Goldilocks situation. So we want it to be snug, but not too loose so that you could shimmy it off, and not too tight that it's causing constriction or making it difficult to breathe or is really uncomfortable. So typically you can fit at least a few fingers down on the inside of it. It should feel nice and comfortable and supportive. That's how snug we want it to be. The next thing is, if you notice, these have little pleats built into them. We call these panels. So this is technically a 3-panel binder. Unfortunately, these little pleats can dig into the skin. So I will often tell my patients, make sure you're watching out for that. Because if this pleat right here digs into the skin, it can actually put a lot of pressure on that skin and cause a wound. It can cause scarring in that area. And those are all things that we don't want. So this is most common when you have a small little waist after your tummy tuck surgery and more curvy hips. It tends to just bunch right here. So I'll tell patients, just make sure you kind of smooth it out periodically, make sure it's nice and smooth and not pleating. The next thing is that these tend to have sharp little corners on them that can dig into your skin. So if that is happening, you can either bend it over, or more commonly, I just tell people, just cut off that corner. No big deal. You've got plenty of Velcro in between to hold it in place. So if that's bothering you in either area, just cut it right off. And then the last tip I would say is, know that it is okay to wash this. It's going to get dirty. It's going to have some fluid leak on it. It is totally okay to wash. I would typically say wash it by itself, because that Velcro can kind of stick to other clothing items in the wash. But know that it's fine to wash it. No big deal at all. And then my last tip I would say is, when you're first getting used to taking this off and putting it on, it's nice to have a buddy help you. So if you just open it, it can kind of spring open. And that can be a little startling. So I would say it's nice to have a buddy help you kind of hold it in place while you gently open it, so that the pressure and the support is released slowly. Now, the same thing is true when you're putting it back on. At first, it's going to be kind of hard to figure out, how do I hold this on one side and put it over? Sometimes it just helps to have someone help you kind of hold it in place while you cinch it across. Now, with time, you're going to become a pro at this, and you won't need help. But initially, it is nice to have a little bit of extra help. So those are my top tips. Hopefully that helps give you some guidance and shed some light on some common questions. And if you have any other comments or other questions, feel free to drop them below.